Good afternoon, everyone, and thank you so much for joining us today. I'm Jenny Jenkins, Executive Program Director of the Corporate Health and Wellness Association and Global Healthcare Resources Executive Group. On behalf of the CHWA, powered by GHR, we would like to welcome you to our webinar, which is titled Innovations in Self-Funding. Our first part of the webinar is entitled Medical Breakthrough, a Novel Approach to Breast Cancer Screening. Today's webinar is brought to you in partnership with Wellways Medical. Before I introduce you to today's speakers, I wanted to share a few housekeeping notes. So today's webinar counts towards continuing education for SHRM and CCWS, as well as the designations SICS, CVBS, and CHRS. We'll be emailing you the instructions post-webinar on how to self-certify for all of these designations. In addition, we've incorporated several add-on benefits to your participation in today's webinar. First, we have audience polling, so we do want to hear from you. We've built in several audience polling questions, so please join us during these opportunities and share with us your insights. So additionally, we have a download area. So if you look to the right of your screen, you'll find a little toggle that says download. There, you can see the download, which we will provide you with more information about the revolutionary new innovation that we're sharing for these webinars. So you may type your questions also in that open Q&A chat box at any time. We may have time for a short Q&A section after today's fireside chat. So please be sure to use the Q&A section and not the chat section, because then we can keep track of your questions and get back to any unanswered questions that we don't get to after the event. So please, again, use the open Q&A section and not the chat section for your questions. Today's webinar will be available 48 hours from today, and we'll be emailing the replay to all of our participants. You can listen to it again if you like, or you can share it with your colleagues. So before I get started, I always like to start with a polling question. And again, I mentioned that we'll be doing this, and I'll welcome the speakers right after that. So first polling question, how many of you are doing something you feel is revolutionary in the area of breast cancer awareness for your clients or your employees? So I'm going to give you about 20 seconds to answer. So I'd love to see everybody participate in the poll. All right, we have just a couple more seconds here. Oh, wow. Okay. This is very interesting, and thank you so much for sharing. It looks like our poll results are in, and about 13% of you feel like you're doing something that's revolutionary. About 69% of you are saying, I don't think so, and 18% really aren't sure. So I think that that's very telling that these types of educational webinars that bring together new innovation and especially revolutionary innovation can really help your employees and save lives. So we're really excited. So let's get this discussion started. I'd like to welcome our first speaker, who is Jaime Pira, who is the Vice President of Sales and Marketing for Wellways Medical. He's senior executive with 25 years of pharmaceutical and medical device industry experience, including 15 years of working as a managing director. So Jaime will introduce our first speaker, and I'll pass the gavel to Jaime to introduce him.
Okay, very well. Well, thank you very much. Thanks, everyone, for joining the webinar. Our next speaker is Dr. Alberto Montero. He's an oncologist that specializes on breast cancer. He's working at the Cleveland Clinic. He works daily with patients that deal with breast cancer disease. And in addition to dealing with patients, Dr. Montero is also a certified black belt in Six Sigma, Lean Six Sigma, which also speaks a lot about the importance of managing the whole continuum of care and improving processes in the clinic. With that, I pass the word to Dr. Montero.
Thank you, Jaime. Thanks everyone for participating. So what I wanted to talk about is why the Cellbria, the product that Wellways makes, which is a mobile breast thermography pad, why I think that that's a very innovative technology that I'm excited about, that I think will make an important impact on earlier detection of breast cancer. But before I talked about that, I really wanted to give just a general background on the overall impact of breast cancer and the overall incidence and epidemiology. So breast cancer is the most common malignancy in women, as you can see highlighted there in the US alone. Last year alone, approximately 266,000 new cases. This is also the case worldwide. So globally, breast cancer has a big impact on women and is the most common malignancy, not only in the US, but worldwide. This next slide, I think, is of value because it shows that over the last 4 decades, while other cancers, if you could see in the red, lung cancer and colorectal cancer, the overall incidence has been going down, mainly because of decreased tobacco use and other things. But breast cancer, even though we have good screening tests, the incidence is really about the same. And so I think that illustrates the importance of getting improved screening modalities that can complement mammography, because the earlier that a breast cancer is detected, the better impact we're going to have in terms of outcomes. And so this data is also from the American Cancer Society, and I'm sure that to most of the audience is probably not surprising that the earlier you detect breast cancer, the better the outcome. So this just shows if you detect breast cancer at the earliest stage, stage 0 or stage 1, the 5-year survival rates are, in the 90% and above. Whereas if you detect at the most advanced stage, stage 4, which unfortunately is not curable at this time, that 5-year survival is very low. And again, detecting a cancer at stage 0 or 1 can make the difference between just having surgery versus having chemotherapy or radiation therapy. So it's really important to find ways that we can improve earlier breast cancer detection. So not only are outcomes worse, but I'm sure also it's not surprising to anyone listening in that the cost of treating breast cancer, depending on when it's detected, can vary greatly. So in the blue or orange, if breast cancer is detected at stage 0 or 1, the costs are about 3 times as less than in the advanced setting. And again, that goes back to the difference between just requiring surgery alone versus use of some expensive chemotherapies. And in fact, one of the important drivers of rising healthcare costs in the U.S. Are the cost of drugs, and specifically the cost of oncology drugs. They're very expensive. So, earlier detection not only improves outcomes for patients, which is what we want, but also reduces costs. And in a value-based environment, it's also important to do what's right for the patient, but also to try and lower costs as well. So I just wanted to show this slide. So these are breast cancer screening guidelines. There's a variety of different ones from different organizations, but the bottom line is that in women with average risk, so women have high risk because they have a genetic mutation or family history, are going to follow a different pathway. But for women with average risk, you usually start a baseline mammogram at age 40, start annual mammography annually, up until about age 70, and then depending on the patient's history, you may or may not need to go beyond that. So mammography has been the gold standard for a very long time, and it's a good test. I'm having a little delay here. Oh, okay. And so this slide shows that overall, mammography is a good screening test, and shows that the sensitivity can vary on different conditions. And one of the most important conditions is breast density. And so as you can see in the picture, the difference between the mammogram on the left-hand side and the far right, it would be easy for a tumor to be hiding in an extremely dense breast, and that's why the sensitivity and specificity decrease. Again, sensitivity has to do with detecting a cancer that's really there. Specificity has to do with false positive. You don't want to test that says somebody has cancer when it really doesn't. So not only, oops, sorry, the slide advanced. Not only do you want a, not only is breast density impact on the sensitivity of mammography, but it's also a risk factor for breast cancer, because the more dense a breast is related to the amount of estrogen production, and that is why in younger women mammography actually is less sensitive, because younger women are going to have more estrogen production, have denser breasts. So when you're thinking about, well, how can we improve on mammography? As a general principle, any technology that you're looking at to complement it really should have the following criteria. It should be simple, it should be cost effective, it should be very sensitive, it should be widely available, and it should be scalable so you can do mass screening. So if you think about something like breast MRI, which is an important tool that we have, it is highly sensitive, but it's not simple or cost effective. You can't get there are not MRI machines everywhere, so it's not really scalable for mass screening. So an MRI is not a modality that would be ideal for sort of on a mass screening basis to complement mammography. So at this point, before we talk a little bit about Cellbria and what this mobile thermography pad is or how it works, the important principle is that whereas mammography and MRIs and like CAT scans, all of these are anatomic imaging approaches, Wellways or the Cellbria is a what I would call like a functional assay. So instead of looking at the anatomy, it's looking at a biologic process. So when you think about what is the biologic process that all cancers have, it has to do with blood vessel formation, or what's called angiogenesis. And what that is that at the earliest stage of a tumor, as a single cell, as it's growing and reproducing and creating more and more cells, a tumor can't grow beyond a certain size without a blood supply. And so what it does is the tumor produces substances that your body normally makes in response to having an injury to create its own blood vessel supply. And that blood vessel supply, the tumor becomes very vascular and it generates heat. So you could exploit that as an imaging modality to be able to detect cancer early on if you could have sensitive detection of differences in temperature within the breast, for example. So with the Cellbria, the initial studies, which were screening studies just to look at what the sensitivity and specificity were of this technology, the initial studies involved about 2,000 women in 2 different centers, one Memorial Sloan Kettering, and other Strax Institute of Fort Lauderdale. As you can see there, the sensitivity and specificity compare quite favorably to mammography. So additional studies wanted to ask the question of how about in women who have an abnormal mammogram or have an abnormal exam. Just waiting to advance the next slide. My apologies. There we go. So in the initial validation studies, I think it's important to note that even in younger women, again, the ones who have denser breasts where the sensitivity of mammography would be less, the sensitivity and specificity was still quite good, regardless of through the whole age spectrum. And I think that's an important aspect of this technology. So again, I was alluding to, in a follow-up study in about 180 women, the question was in a higher risk population. So instead of a screening population, how about in women who had an abnormal mammography or a breast exam? How effective was Cellbria in detecting breast tumors? And so in this slide, it shows that if you look at the distribution by size, the Cellbria was pretty sensitive, even in tumors less than 1 centimeter, or pretty small tumors. It was pretty effective in detecting the smaller ones, which I think is an important component when you're thinking of complementary technologies to mammography. And then again, in the next slide, you'll see that again, the spread of the age range, and again, even in the younger ages where mammography is less sensitive, Cellbria had a pretty, had a very good sensitivity. Okay, and so in my final slide, the Cellbria technology has been tested in over 5,000 patients in at least 14 different clinical trials, of which most were done in the U.S., but there are several of those that were done internationally as well. And so I think that this is in part because of the data and the novelty of this imaging approach, is why I think that it's a rather innovative imaging technology. And with that, I think we're also going to have some explanation later, a little visual explanation, a little presentation on what Cellbria actually is to help better understand that.
Wow, Dr. Montero, thank you so much. That statistics and data that you shared are, really, it's just very telling, and it's so important for us to understand from the clinical side how breast cancer, impacts employers for their employees and individuals in general. I do have one question really quick before we move on to the rest of the program and the video and all of that good stuff. How do you see, Dr. Montero, how do you see advancements with Cellbria impacting breast cancer in the next few years?
Well, I think it's very complementary, but also one of the trends in healthcare overall is really to empower patients to be able to take more control of their own healthcare, and the fact that this is something that a patient can initiate themselves and they don't have to necessarily go somewhere, I think is one of the biggest impacts that it'll have.
Awesome, and that gives us, I think, leads us to the kind of next section of our presentation. So we have a very short video that will kind of explain innovation for self-funded employers on this particular kind of new innovation. So we're going to play a quick video for you that is just really going to kind of recap what Dr. Montero kind of talked about, and we'll go on from here.
Breast cancer has become an epidemic, with 1 in 8 women diagnosed with breast cancer. We need as many tools as possible to give women a fighting chance. When breast cancer develops, new capillaries are formed to support the growth of the tumor. This process is known as angiogenesis. New capillaries increase the blood flow, causing the area to give off more heat than normal. Cellbria thermal mapping device is designed to detect this increase in heat. The sensors are applied to a woman's breasts. Heat from the skin is conducted to the sensors on the 3 foil segments. As heat is conducted to the foil segments of the pad, the sensors turn from blue to pink at a particular temperature. The pink dots indicate the temperature of each region of the breast. Cellbria TMD is unique in providing immediate results of breast abnormality, including breast cancer.
Awesome, awesome. Thank you so much. Can you, Jaime, I just didn't want to interrupt the video, and I was trying to figure out where it was. Can you elaborate on this particular product and as far as how it relates to, kind of helping women kind of detect early breast cancer? Can you elaborate a little bit more on Celbrea?
Sure, sure. Well, I think after Dr. Montero's explanation and review of the clinical data, we want to share the enthusiasm we have behind Celbrea TMD. This device was designed precisely to detect heat signals on the surface of the breast. And as you saw in the video and the explanation from Dr. Montero, most breast cancer tumors will be generating this angiogenesis effect and therefore generating heat. And this is why our sensitivity results and specificity results have demonstrated Celbrea to be very effective. Now, how that is going to be incorporated? Think of the many women that you have in your plans, in your companies, and think of how many of them will be developing cancer in the course of their lives. And as Dr. Montero demonstrated in some of the slides, the earlier you detect this disease, the more choices, the better prognosis that the patient will have, the lower the cost and the lower the medical impact on the person. The recovery rates will be much faster, and so there is a very important strategy to try to anticipate the detection of that breast cancer growth. The other important comment to address is the population ages. Currently, mammography is indicated for women after the age of 40, precisely because of the concerns related to the radiation involved and so on. As the clinical trials have demonstrated, our device is capable of detecting heat signals independently of the density of the breast. So in this patient population, so in other words, the younger population, anybody below age of 40 that is still not being covered by any other screening methodology would benefit from the use of a device. Now, the intended use for Celbrea is a prescriptive device that has to be eventually used as an adjunct to either mammography or other screening methodologies, as self-examination or clinical palpation from your doctor. So we see it as a complementary tool and one that will help in that advancement of the detection to an earlier stage, and therefore making it possible for doctors to really do a much simpler treatment options.
Well, thank you for that. And now I would like to jump right into our fireside chat. I will reintroduce, we also, of course, we have Dr. Alberto Montero, and we have Jaime Pira, and I want to also introduce two guests that are part of our chat. We have Jesse Gavin. He's Wellness Team Lead in Human Resources and Benefits for Baylor Medical College. And we also have a guest speaker, Kelly Jenkins, who's Manager Business Development at Wellways. And I'm going to start my first fireside chat question with you, Kelly. Of course, the rest of you all will have an opportunity as well. But Kelly, thank you so much for joining us as a guest speaker for this webinar. Can you tell me a little bit about why you're passionate about breast cancer education and your personal experience?
Yes, you bet. I'm passionate about breast education, breast cancer education, particularly for three main reasons. And they're pretty simple. The first reason is my daughter. The second reason are my sisters and family and close friends. And the third reason are really everyone else, every other woman around the globe. Quick little anecdotes about those three areas that I'm passionate about. My daughter now has cancer from family history on both sides. I was diagnosed with breast cancer. I'm still in reconstructive mode. And then her grandmother on her father's side also has had breast cancer. So she has it on both sides. She's in her mid-20s. And quite frankly, even though mammographies are helpful and are the standard right now, I don't necessarily want her to have to wait till she's 40, since she is at higher risk. I have a sister-in-law who felt a lump. She self-discovered a lump, went to her gynecologist, and who ordered a mammogram. She went and had a mammogram. It came back clean, like there was nothing wrong, but she still felt odd about it. So she asked her gynecologist if she could actually have an ultrasound to kind of go to the next step. And her gynecologist, her doctor said, no, it's not necessary. The mammogram came back clean. Long story short, she changed gynecologists. She felt like something was up. And then she did go have an ultrasound, and a lump was found. And 3 weeks later, she had a double mastectomy. And then lastly, on the global women, we're right now trying to launch Celebrea nationally, and we will eventually internationally. And I had a story when I first came home from the hospital. I was in Miami, and my doorman, who helps with everything, helped me for the next weeks with visitors and meals and things of that sort. And finally, one time he was helping me upstairs, and he had kind of a real solemn look on his face. I said, "What's up?" And he said, "This is reminding me of my mom and my sister." And he lost both his mom and his sister. He was from a country in South America where they just didn't have access to good care. And just the fact of having access to screening earlier as an adjunct to mammography is going to be a life changer for families and many, many people. So briefly, my story, many of you know the story already, but I was diagnosed 2 years ago. In fact, I was diagnosed this very week. It was right around Valentine's Day that I was diagnosed. It was in February, and I was in Miami at the time. And so in March, I had a double mastectomy. My tumor actually was 7 centimeters. And so that moved it from stage 3A to stage 3B because of the amount of lymph nodes that it was in, and also because of the size of the tumor. And we were able to find that out, obviously, through an MRI. But I was also estrogen positive. And so when I saw Dr. Montero's slide about the mortality rate and the survival rate as you move through the stages, made a quick little note. Stage 3A is 67%, stage 3B is 41%. So it drops off from there. So right there is just that fact alone is you can get screened a little bit early. So I had radiation in Miami, moved back to Los Angeles, which is home for the reconstruction process. Had 3 surgeries last year, have another one in a few weeks. So it's a journey, and it's a journey that affects everyone. And I know, because I've been involved with self-funded employers for years and years and years, how awesome would it be to be able to offer this type of screening, whether it's with a healthcare that already is occurring or whether it's an on-site clinic. And my goal is to be an ambassador for early screening and detection in as many places as we can.
Wow, Kelly, thank you for having the courage to share your story. And, you're a survivor, and we're so glad that you are. And we're so glad that you have passion for this, because it takes somebody that has a real true experience to really communicate, what early detection would have meant for you. And, if you had this technology, when 2 years ago, when you were diagnosed 2 years ago to this week, what would this have done for you and others in terms of early detection? And I would say that to the entire group, you, Kelly, first, and then anyone else that can weigh in on that.
Well, it's crazy. I didn't know until I was diagnosed, until I met Wellways at about the same time, that dense breasts were even a thing. We're not educated about that. And so I had clean mammograms up until my diagnosis. And I thought, why? Why does that happen? How do women have clean mammograms and then they still, end up being diagnosed at a later point in time? And what's crazy is that as I was learning about angiogenesis, it reminded me when I first went to a doctor. This was in California before I moved back to Miami, and I had been having, after certain kind of incidences, whether it was a shower or a lot of massive exercise, there were certain times that my breast would get extra red, and it was just kind of spotty reddish. I took a picture and took it to my doctor, and he ordered a mammogram, of course, and then it came back clean, and my next level did come back clean. But who knows if that was the start of angiogenesis, but Celebrea can actually detect a tumor or a growth, and we call it 0.5 centimeters. That's a half a centimeter. And by the time another diagnosis is 3 centimeters or so. So early detection would have saved time, money, emotions, just a lot of things. And it's not for me, obviously, but that's why I'm passionate about it. We need to detect these when they're at a half a centimeter or 1 centimeter, not at 3 inches or 7.
Right, and I think it's really telling, that you had several mammograms and, it was undetected because of the dense breast. And so, anybody else that would like to weigh in just like on education and your knowledge, prior to what you've heard.
Sure. Well, thank you again, Kelly, for sharing your journey, your story. It's always really fascinating to hear it over again. The angle that I would like to take on that point is going back to one of the slides that Dr. Montero showed earlier today when he was speaking about what objectives to the new device, to the new technology, what criteria should it meet. And he spoke of simplicity, affordability, sensitivity, etc. And this is where we believe that we're onto something here. We at PMD is a very simple testing procedure. There's a lot of technology and science behind it, but the actual application of the technology is very simple. In case we haven't mentioned it, this is a 15-minute test that is done by the simple application of 2 breast pads, 1 for each breast. The test lasts 15 minutes in a non-invasive, very easy to read manner. You can read the results right then and there, and there you go. You will know whether there is the presence of a breast abnormality in your breast, and that taking ownership of your wellness and your well-being is made possible by the simplicity and the elegance of the design of our device. And that's perhaps the way I can answer that.
Well, thank you for that. So before I move on to the rest of the questions, I want to engage the audience. I'm blown away right now just by Kelly's story and just some of the things that the statistics that Dr. Montero has shared, and you, Jaime. So, we have lots, more questions to go with the fireside chat, but based on today's presentation, I'd like to go to a polling question if I could. The question is, based on today's presentation so far, do you feel females associated with your health plans could benefit from this new device, just based on what you've heard thus far? So we can open the poll. I'd love to hear your thoughts. Do you think that your plan members might find a benefit to this? Maybe, but you want more questions, or you have concerns, or not so much, you're not sure? So the poll is going. Appreciate everybody working on answering. And there it goes. Thank you. So interestingly, it's about half and half. Yes, half of you are, thinking your plan members would benefit from this. The other half are saying, really, I have some additional, questions or concerns. So I think, that's really, telling as to what we're talking about here. And appreciate you guys weighing in. Thank you so much. So the next part of the fireside chat, I want to pull in Jesse, who's our employer today. And Jesse, I'd love for you to kind of share your experience as an employer and like how you're helping educate your employees on breast cancer awareness and the types of things that you're currently doing as an employer.
Yeah, absolutely. Thank you very much. And Kelly, that's amazing. It's good that you were persistent to say, I still don't feel right, and something is going on. So you kept pushing till you kind of found that out. So that's amazing. I think with wellness programs, and Jaime mentioned it, is that it provides a great platform for education. We provide incentives for people to go get their preventative screenings. We educate people about the age-specific recommendations about to get those done. We're actually very lucky. We are in Texas Medical Center, and so our employees have access to a lot of different resources as far as when to get the test done and where they can go. But like Kelly mentioned, there's still a lot of there can be false positives, and there's some education that just doesn't make it to the patient. So just from Baylor's standpoint, I think from the early detection, we are looking, and as Dr. Montero mentioned, cost is a big thing. And so we have our genetics department working on some tests to where, if the cost is in line, they might be able to determine if someone has the variant of developing breast cancer. Not saying that they necessarily would, but having that information would lead to this person can do earlier testing than what's recommended. So it makes it very specific to the individual rather than just making a national recommendation across the board that we've heard, 40 might not be the answer for everyone, which of course it's not. And of course, I don't know personally, but I imagine, making it simple with this device and just the intrusion process. And I'm sure going to get your mammogram done is not comfortable by any means. And so with something like this, it might lead to a lot more people being willing to go get this done than having that kind of fear of what's going to happen.
Well, Jesse, gosh, you made so many great points, and I'm thrilled that you offered those type of benefits and things to your employees. And just, if you think about it, it just makes so much sense because I've been in the wellness industry since the late 90s, and I remember when we were pioneering biometric screenings, when companies that were forward thinking and wanted to get the wellness benefits were first doing that. And just imagine if you had a little cubicle or a conference room or something set up during your health screening fair, or you have an on-site clinic, even better, and you could do it that way. Because how many times of the women in the audience have made an appointment to go get a mammogram, fully intended, put it on our calendar, and half an hour before we leave work to go get it done, something comes up, and you just don't. And so it's not that we're purposefully trying. Some do, because it does hurt. So there are many, many reasons for not having a screening, and they're all well intended. It's the convenience alone, let alone the safeness, the cost, and the accuracy, all of that. Just the convenience to be able to do it at the workplace, to me, is revolutionary.
Yeah, absolutely. I think one of our business health groups down here, the director's main quote, their mission is to enhance the employee cost, convenience, and employee experience. And I think this device, kind of that whole spectrum, low cost, convenient, and then the experience from the employee is probably going to be a lot better on many, many levels. So yeah, I completely agree.
Great job, Jesse.
Thank you, guys. And, one other thing that, you were talking about too, Kelly, and I think it's interesting to kind of think about now is, how many employers and groups on this line today have on-site clinics or worksite clinics and those types of offerings, where, they're doing something, to do early detection or screenings for breast cancer. So I have another polling question, get the audience involved if we could. Do you have or are you affiliated with worksite clinics or specific clinical provider? Just yes or no question, and we'll give you a couple seconds to answer. All right, looking at the poll here. Waiting for the results to come in. A few more seconds. So looks like about 31% of you have an on-site worksite clinic or a clinical provider. About 69% of you do not. Assume those that do not likely do health fairs. Probably both of you do. So it'll be a really interesting question to even further delve into. But that's important to understand as well. So thank you for that. I have another question for Jaime. And all of you can weigh in on this. We kind of touched on genetics, and of course, Dr. Montero talked about it. But from a genetic perspective, Jaime, can you go into how much of getting breast cancer is genetic versus environmental from statistics?
Okay, well, I'll of course let Dr. Montero speak to that in more detail, but the data that we have reviewed indicates that roughly 10% of breast cancer patients have a genetic mutation or family history. So that leaves the rest of the 90% of the population not really being all that aware of the possibility of developing breast cancer. So that 10%, of course, is a high-risk population that would probably generate a more frequent and more continuous screening methodology. However, the remaining population is not really in their radar, and that's why the simplicity of a new screening methodology would help bring them earlier into the screening process. But I would prefer Dr. Montero to address the genetic mutation issue and that prevalence.
Yes, please.
Yeah, well, you're totally correct, Jaime. So about 10% of all breast cancers are hereditary, and by hereditary, I mean, you think of like a BRCA mutation, so mutations that cause cancer, breast cancer, or ovarian cancer in multiple generations. That means 90% of breast cancers we can't identify what the cause is. The incidence of breast cancer is going up in the U.S. and in many other countries, in part due to the obesity epidemic. So fat tissue makes estrogen, and so it does increase the incidence of estrogen-related cancers, of which breast cancer would be one.
Thank you for sharing that. Really appreciate the feedback. And so I think what's telling about that too is I think, all of these screenings are imperative, really. The, fact that we've got new genetic tests that can help us determine if, genetically we have predisposed. And now we have better understanding of early detection through education that you've just shared today, which is, other environmental issues or behavioral issues that can make it possible for you to have breast cancer. And then, of course, having Kelly share her story with us and looking at what Jesse's doing as an employer, I think, there's just a lot more we can do. And I feel like, pilot programs and other things need to take place to help employers truly gather better data for their employees, save more lives, save costs, of course, as self-funded employers, but most importantly, first and foremost, is save lives and at a much earlier stage detect breast cancer. And Kelly, I do have one more question, and I think I'll address it to you since you had the courage to share your story. And if you could accomplish one thing from telling your story, what would that be for employers and individuals, women?
Oh, it's a great question, Jenny. It really starts with awareness. It just like really any big issue, whether any issue we're facing politically, whether we're facing it in relationships or family issues, everything really starts with awareness of what is going on and what's available. Just like the fact that at my age, I didn't really ever hear about dense breast until just the last couple of years. Women need to know that. So even if employers can't quite offer screenings yet, they can offer education. Education is free of charge. If there's anything that we at Wellways can help do as far as even providing materials or education, that would be great. But I think it's increasing the awareness level. One of the things that I also learned that I didn't know, I was invited to attend a retreat with Borders for Breast Cancer. And these are young women. These are young women, elite athletes. It was founded as a nonprofit because of an elite athlete, a snowboarder who had breast cancer and passed away. And these are her peers now. And all their mission is about increasing awareness, because we know that even though the numbers aren't there for younger women, if a younger woman is diagnosed with breast cancer, it's typically more severe, and it's a more aggressive case typically. And so it's not too young. It's not too young to start educating our daughters. How many times even in junior high or high school were we actually told what a self-breast exam is and how to do it properly and what to feel and what to do? And so for years we've all done breast exams in the shower and probably found something, but is it a lump? Is it a cyst? Is it because I worked out too hard yesterday? What is it? And so really all those frequently asked questions, I would love a gigantic document that we could just give everybody in America. Yes.
I think, one of the things we could do too is offer, kind of lunch and learn type education and training from what we've learned today in an environment where you and others, we can all share this, as mass education just to really involve, and I know that that's part of the the whole idea of bringing new innovation is to educate, and that'll be something I know that we'll do down the road consistently with you all as a. And I do have a question also from the audience, and before I jump into that one, Jesse or Jaime or Dr. Montero, is there anything you'd like to share just about like maybe something that surprised you from what Kelly said, Jesse, or kindly, I don't want to interrupt anybody, but love to hear what you thought and your ideas about that.
Well, I tell you what, one of the things that has surprised me, and quite frankly, just simply because we didn't have access to that data before, and that is the financial impact that women who suffer breast cancer go through. So, of course, the medical implications of being diagnosed with breast cancer are very significant and are the priority. However, there is a whole other story to tell, which is the financial impact that disease generates. And of course, the further advanced the disease is in, the more costly it will become, the longer the recovery time will be, and of course, the lower the survival rate. And so we found some data that nearly 60% of women that are diagnosed with breast cancer eventually go through a significant financial impact, whether that be filing for bankruptcy, incurring into significant debt, losing their jobs in some cases, and many other economic implications that should not be the sole focus of it, but it's part of what makes this disease, is what we believe to be a preventable disease in the sense that it can be caught earlier. That's what makes it so compelling for us, and it's a strong call for action. It affects the fundamental pillar of our society, is a woman, is a mother, is a sister, a daughter, that is being affected, and that affects the whole environment and the whole family.
Wow, thank you.
Just what she said, I think time is key. I know that our breast cancer center does same-day testing, same-day follow-up. Kelly, I'm not sure whenever you got your first test, but it could take weeks.
Right.
And
wow.
So that's a
cool.
whole time where, like you said, is what's going on? Is it this? And so that's something that we really pride ourselves at Baylor, and our breast cancer really does the same-day testing, same-day results, same-day next follow-up if it needs to be. So because time is key. And I think we also, we look at the psychosocial aspect as well, because it's big news. And again, I can't speak from experience, but I can only imagine just all the thoughts that are flooded in, and just depression and like I mentioned, financial. And so it's important for us to look at the holistic, every dimension of wellness, from financial aspects to psychosocial aspects to physical aspects, of being drained from chemotherapy and stuff like that. So I think that's something that we can really work on going forward. But as Kelly mentioned, the earliest that we can get education out, the better. And so that's very important. And I think that just letting people know that it is, 10% genetic, but there's still 90% that we can do. Like, we have power to really impact our own health, and just kind of showing people that it's just not, even if they do have the genetic makeup, it's not the end of the world. You still have a big part in what happens in your future.
Jesse, thank you, Jesse, again, because that just brought up a thought that I feel is really not addressed when you talk about holistically the entire process, the entire experience that a woman goes through. And I'm very blessed. I'm a survivor, but I'm still in the reconstruction phase. And what is not paid as much attention to, there's plenty of resources when you're in treatment, but when you're done, you still don't have full range of motion. You still can't do a push-up. You still you can't reach above your head. You can't do a yoga pose, There's still certain just daily activities of living that you just can't do. And so then part of what Jaime said, that's kind of on your dime. You've got to, there aren't as many resources or plans that cover what I'm calling the rebuilding process, which to me is as important, because I want to get back to full functionality. I want to get back in the ocean on a surfboard. I want other women to be able to have the resources that those of us who are blessed to have good insurance programs have, and that's not the case. But from start to finish, there's little gaps in the system that we need to be aware of so that we can plug those, and that just goes back to increasing awareness again.
Yeah, absolutely.
Dr. Montero, any thoughts on that as well?
It's hard to add to that. It was very well said by everyone. But I think for me, I think the two themes are, number one, I think Kelly's experience is humbling because it shows the limitations of current technology, and that we need to improve on that. I think the other one that I want to echo is time to diagnosis or treatment. That's something that has been shown to improve outcomes. That's something that at Cleveland Clinic, the Cancer Center, we look very carefully at. And so not only is there a psychological component of anxiety of not knowing what it is, but also to, once you know what it is, to get started on treatment as soon as possible to give patients the best possible outcome they can get.
Well, thank you. We do have a couple of questions from the audience. The first question I have is from Cooksey, and they're asking, how much does Silbrea cost per unit? And is there a minimum purchase or amount of quality? Is that something we can discuss today, or is that something we can perhaps talk about directly with each employer?
We can have a first conversation about it today, and of course, as we engage more directly with the employer, we can go into further detail. Silbrea TMD will be available in the latter part of the summer this year, and we have been we're finalizing our pricing decisions at the present time, and the price range that we have been testing is below $100 per test, and that's a single-use device, and that's going to be roughly somewhere between $85 and $90 per test. So to the question of price, that's what we're aiming for, and that answers to one of the aspirations of new technologies, as Dr. Montero said, to make it affordable. The objective is to make this as broadly available and accessible to people. Since it doesn't require any capital investment because it's not attached to any other major medical equipment that you have to invest on, the device is the only cost that you would have in conducting the test.
Okay, and how would a self-funded employer roll something like this out for their to add to their benefit plans? Another question.
Let Kelly take a turn on that.
Yeah, you betcha. And Jesse, you can too, because you are an employer. But as I've worked with employers throughout the years, there's many different ways. Obviously, if you have an on-site clinic, that's the easiest and the fastest, because currently right now, Silbrea does have to be prescribed by a physician. And so if you have an on-site clinic, you can get it prescribed, and you could do it there. If they're cracked in the clinic, you could actually make an appointment and go at any time all year round. So that's probably the easiest. We have been working with employers who want to do more of a traditional health fair. And so then it would be advertised, promoted, and we would help you. We have all types of education and things that we would be able to help not only promote it, but help provide education and clinical personnel for staffing and reading of the device, etc. But that is one way of being able to do it that's a little more planned out, and that could be paid for either in a one-time use. Some employers kind of morph it into a PEPY or PEPM. If that's the kind of structure they have, it's not really necessary because it is a one-time disposable use. But there are many ways to kind of plan it or put it into plan offerings for your employers. Sometimes it happens during open enrollment, and so then the following fiscal year, whenever that starts, say if it's open enrollment, it's October, November-ish, then the benefit could start sometime in January. The one thing that actually we are looking to partner with and work with are for those employers who have an interest and a desire to have a health fair to bring it on site, but don't have an on-site clinic. There are some ways that we can work with telemedicine doctors as well in order to keep that confined into the employer. You will lose some people if you have to have them go to their primary care physician, get it prescribed, and then bring it back. There are ways that we're working out to make that seamless as well with technology and apps and all of that. But there are a myriad of ways that we can implement once an employer is interested.
Awesome, thank you. Well, there are a lot of questions in our Q&A platform, and so we're not going to have time to get to all of them. In the interest of time for all of you, and Kelly, Jaime, Alberto, Jesse, I can't thank you enough for giving us your time and giving our attendees the time to hear this vital presentation. And before we jump into our next presentation, and before we move to that, I do have one last polling question. I really would like to understand if everybody's kind of gathered what if the information resonated. So the next polling question I have is, would you be interested in participating in an innovative new solution that will save money as well as lives? And there are some answers there that you can answer. I would consider it, etc. So the poll is open, and love to just hear from you if we've made an impact in helping you understand, what we're trying to do with early detection. So just a couple minutes for the poll to take place. The majority of you have, shared that you're an employer, you want to know more, a broker, you want to know more, have additional questions, which I'm sure you do. And so we just really appreciate that feedback. As we bring this kind of education and content to all of you, we want to be able to, really showcase, something that will make a difference for your programs. And whether you're fully funded or self-insured, something that's vital to saving lives, I think, is imperative. So, in closing, on behalf of the Corporate Health and Wellness Association and Global Healthcare Resources, I want to thank our sponsor, Wellways. I'd like to thank each of you for joining us, and we will be jumping, of course, into our next presentation. But before that, I want to give my utmost sincere gratitude again to today's speakers, Dr. Alberto Montero, Jaime Pira, Jesse Gavin, Kelly Jenkins. Thank you guys so much. And now we're going to take a quick break so that we can start our next presentation. So bear with us while we transition to our new speakers and we jump into our next topic. And again, thank you all so much, and we will jump into our next topic.
Thank you, Jenny. Thank you, everyone.
Bye
now.
Thank you, Jenny.